In this video I'm going to be talking about dealing with death as a student nurse and further on in your career as a registered nurse. Death is something that's common to all branches of nursing, wherever you work, not maybe perhaps every ward, but in each field death is a reality, and the first time you see it as a student in that position, it can be very distressing, and finding healthy ways to deal with it and be able to move on and not affect you in long-term and delivery care is something very important. I had my first experience of death on my neonatal placement, and it was difficult. The patient wasn't someone I had known for a long time in terms of that I looked after them a lot, but there was someone I was aware of, someone on the ward who seemed to be progressing well and suddenly crashed, and I was present at the crash call, and everything started to get a bit dramatic, if you will. And I suppose I found it quite difficult to deal with initially because I had already left while my shift had ended with an uncertainty as to whether this baby was going to pull through or not. And leaving with those feelings, I'd already started internally to try and realise and work out these feelings. And it was only when I returned from my next shift that I discovered that this baby had passed away. I would say to you, first of all, it doesn't matter how well you knew a patient. You could have looked after them every day for a few weeks, you could have looked after them maybe once, but either way, an absence of someone in the ward can be quite tricky to deal with, I think. So I'm just going to give you a few little tips and things that I found helpful with it, and things that you can do just to make yourself feel better, get over the emotions, not dismiss them, but acknowledge you have them and find healthy ways to move on as a nurse. So I find the first thing really handy to do is just talk about it. It's very simple, it's not rocket science, but talking about it allows you to realise where exactly you stand with your own feelings. Other people are more aware of what's going on. You talk to other nurses, other students, your personal tutor. You know, if you want to get the uni involved, then there can be really good support as a student. But don't bottle it up. That's the really fundamental thing I'm trying to say to you. It doesn't really matter who you talk to as long as you maintain confidentiality. You know, that's always the thing, but as long as you're making those feelings known to yourself, and talking can be a really great way of doing that, just to start dealing with it in a more public way rather than trying to bottle it up internally, not really saying what's going on and letting it stress you out. A lot of what you do is really personal and down to you. I think having your own personal helps, I like to call them, is really useful. So things that you would normally turn to in times of trouble, things that make you feel better, things that help you to perhaps ponder what's happened in your own sort of space. So that could be praying, meditating, going for a walk out in the open and just having that space and that time away from the stressful environment of study or work, and just having that time to think about what's been happening. I think that's really helpful to have, so that you remind yourself this is not just a one-time, I'm over it now. It can be an ongoing thing that links with you, but just dealing with it healthily and not dismissing it and just letting yourself have that time to grieve, I think is really important, because we're in a caring profession. We care about the well-being of our patients, and so if one of our patients passes away, we're going to feel sad, and that's completely fine, and don't bring yourself down for feeling sad. I think that's one of the worst things you can do. What I would say is, when in the clinical environment, try and focus on something positive to be doing. So say you've gone into the area and you're quite upset about hearing this news or maybe a scene happening, but then there's someone else who needs your help, and by putting your energies positively into that task, it can be a way of moving on in a positive way. So saying that maybe we couldn't save this patient, but we can do things for this patient, and not doing yourself down and always using yourself positively. and helping others, I think, is really important as well. So, like I said, how you deal with death can be very personal, but you do have to deal with it. Don't pretend it doesn't exist. Don't pretend that your feelings aren't valid. I just say across branches, just having a talk like this, just thinking about how to deal with your emotions, how to keep yourself mentally healthy, physically healthy, and doing the best for your patients is one of the best things that you can learn as student nurses. And I think also talking to other nurses in the team, you know, keeping those feelings open, keeping where you stand open, and having that good relationship and rapport with all those you work with, and keeping those patients how you feel about them and how you want them to progress at the centre of what you're doing, that can only be a good thing.